about this is Dr. Lukoi Atuoli. He is the Vice President of the Kenya Medical Association and the Chair of the KMA COVID-19 Advisory Committee. Dr. thank you for making time for us this evening. Let's get straight into it. Are you getting that feeling as you speak with Kenyans, as you read their comments online, that they're getting tired of the restrictions that will prevent the spread of COVID-19? Is there also a false sense of security in your view?
Yeah, in my view, I think Kenyans are behaving like normal human beings. When you restrict freedom for normal human beings, they start getting restless after some time. These restrictions have been in place for several weeks now, and so it's only natural for people to start feeling restless, to start feeling jittery, and to start feeling like they need to go out. Unfortunately, COVID-19 doesn't respect that kind of behavior, and COVID-19 gives you a false sense of security because the numbers look low in the beginning, but as it starts rising, then you will see the real effect of this kind of behavior. It is normal, but it's dangerous.
Okay, it is dangerous. One of the other trends, Daktari, that we are seeing across the world and here in Kenya as well is where people establish quarantine buddies, expanded social distancing. This is where families or groups of friends begin to regularly interact together, whereas in the past they were not. What is the danger of that?
So, of course, the theory is that the people who are interacting together live in a secluded community and they're not letting anyone else to come in from outside. Therefore, they feel safe that they have no risk of contracting COVID-19 from outside. Unfortunately, this doesn't work because during the day, there's free movement across the country and people interact freely out there and they are exposed to COVID-19. So pretending that you can have a circle of friends with whom you can be interacting regularly is to delude yourself, because some of them will probably come into contact with COVID-19 in the course of the day. So it is not a safe practice, even though it looks safe.
Some would argue tonight, Daktari, that part of the desire to ease up on social distancing is purely from a financial perspective. After a couple of weeks at home, money sources have dried up. People are going out to find ways to earn money. How would you respond to that? The balance with, earning an income, but at the same time ensuring that social distancing remains a reality?
I wouldn't want to be in the shoes of the political decision makers at this point in history, because it is a tough political decision to balance between the health of your population and the health of your people against the economic health of the country. And that decision, the cut point at which a decision is made either way, is a political decision. We can only tell you that if you ease restrictions now, this is the impact on the health of the population for the next 1 year. And if you maintain the restrictions now, this is the benefit over that period of 1 year. However, the decision on whether to ease restrictions or not is a purely political decision that we scientists will also suffer like the rest of the Kenyans.
Very interesting point that you brought out there. I know many Kenyans tonight are asking themselves, so how do we fight off this quarantine fatigue? What warning would you give them at a time like this?
I would advise that, yes, it is normal to get tired, it is normal to get restless and irritable, but what you can do is to have a schedule of activities, vary the things you do, and you still do have the freedom to walk around during the day while wearing your mask, while maintaining physical distancing and keeping your hands clean. Try and work in a routine that is safe during the day that then reduces your boredom risk. But avoid bars, avoid large gatherings, avoid hanging around strangers just because you feel tired of staying on your own.
You are telling us to avoid interacting with others, yet restaurants are reopening even if it's in stages. Isn't that an incentive for some tomorrow to go out and interact?
So there are regulations on how this should operate, but they are very difficult to police. And therefore, restaurants, in my view, are one of those risky areas where avoid them if you can, as much as you can. Go there only if you must. And when you do, maintain physical distancing and observe all the public health restrictions that have been published.
Okay, and finally, as we show our viewers some pictures of today in Kayole, the scenes that our team was able to get, I don't know if you can see them from where you are, but I'm sure you saw the story that we ran. What does that tell you when you look at those images?
Oh, it is sad. It is sad. It is reckless, but it is expected, and we must plan expecting some of the human beings in our country to behave like this. We must have places to take them where they can be separated from other people, and because they have broken the law, then the legal justice system should take effect on them. But we should expect this, but we should do everything in our power to discourage it.
Sounds like a near mission impossible for the decision makers of the country tonight. Thank you, Daktari, for giving us that perspective. Dr. Lukoi Atuoli, who is the Vice President of the Kenya Medical Association, he's also the Chair of the Kenya Medical